Good afternoon, and welcome to Michigan Medicine's Well-Aware presentation. I'm Dr. Gregory Dalack, Chair of the Department of Psychiatry at the University of Michigan, and I am delighted to have you join us. Today's webinar is especially meaningful to me because May is Mental Health Awareness Month. To that end, we will be discussing the impact of the pandemic on children and adolescents' mental health and coping strategies. We know that mental health concerns have escalated during the past 14 months, especially in school-aged kids. Substance use and suicide risk are on the rise. Today, we will provide tips and strategies to help reduce the impact of the COVID-19 pandemic on our kids' mental wellness. Our panel of experts will address some of the many challenges facing youth and their families, including adapting to distance learning, how school closures and disruptions affect children, particularly those with previously diagnosed mental health or learning challenges, the pandemic's impact on special populations of children and adolescents, positive and negative coping strategies, complications involving access and equity, and finally, possible long-term effects the pandemic might have on children. Thank you to everyone who submitted questions in advance. We'll be working on answering many of them throughout the presentations and later during the question and answer session. We will also accept live questions throughout the webinar for those of you joining us via Zoom. Please use the Q&A feature to ask your questions, and we will do our best to get to as many as possible. Now it is my privilege to introduce today's speakers in order of appearance. Dr. Nasu Mallis is Director of Pediatric Consultation Liaison Psychiatry at CS Mott Children's Hospital. He is also Child and Adolescent Psychiatry Service Chief for Children and Women's Hospital and Associate Professor in the Departments of Psychiatry and Pediatrics. Dr. Mallis will discuss impact of the pandemic on youth wellness and opportunities for a brighter future. Dr. Angela Fish is an Assistant Professor of Psychiatry and Training Director of the Child and Adolescent Psychology Practicum and Fellowship Programs. Dr. Fish will speak about the impact of the pandemic on special populations. Dr. Charles Graham is a social worker within the University of Michigan Addictions Treatment Services, and he will talk about adolescent substance use in the context of COVID-19. Dr. Elizabeth Koschmann is an assistant research scientist in the Department of Psychiatry and the director of TRAILS, which stands for Translating Research into Action to Improve the Lives of Students. Dr. Koschmann will discuss promoting child and adolescent wellness during COVID-19, resources and recommendations from the TRAILS program. And now I'd like to welcome Dr. Mallis.
Thank you, Gregory. My name is Dr. Nasu Mallis. I'm the director of our Pediatric Consultation Liaison Psychiatry Service and also the Service Chief for Child and Adolescent Psychiatry at CS Mott Children's Hospital. And I want to take you on a journey with a young lady by the name of Maria. Maria is a 14-year-old female. She has learning difficulties in Crohn's disease. And like many youth that we've seen during the pandemic, she's now exhibiting emerging symptoms of depression and anxiety. Her parents are a grade school teacher and a manager of a local restaurant and have been under significant distress during the pandemic. Maria's experience during the pandemic has been very challenging. She's been socially disconnected from peers, from family members, from important activities in her life, from her academics. She's been more reliant on social media to develop those social connections and has been distressed about some cyberbullying and how she's being perceived in terms of her image online. There's a lot of familial distress. The parents, both working on the front lines, have been under a lot of duress and have been financially strained and worried about an uncertain future, just as Maria is. And all the while, there's been reduced access to resources, school-based resources, community resources, supports from family, and also physical health and mental health resources. Given Maria's academic challenges with a learning disorder, she has struggled with the transition to distance-based learning. And on top of all this, her Crohn's disease has been more active. She's had difficulty getting to GI appointments. And with her Crohn's disease worsening, we know that that worsens depression and anxiety. And we know worsening depression and anxiety can negatively impact chronic illness such as Crohn's disease. So Maria's family takes her to seek mental health services. But unfortunately, the issues around accessing mental health services for youth have been worsened during this pandemic. There are a lack of child psychiatrists, with most child psychiatrists clustering on the East and West Coast and in urban areas, making wait times up to 6 months for many youth in our area. There are limited subspecialty services for youth like Maria, who have developmental needs or chronic medical needs that need a cohesive approach to their care. There's a lack of integration of care, a lack of access to psychologists and psychiatrists that are embedded in medical care settings with the primary care provider or with the GI subspecialist. Therefore, care can be disjointed, and opportunities for communication and discussion of issues around the interface of medicine and psychiatry are limited. And then there are other barriers to care. Barriers such as the tremendous demands on Maria's family and Maria herself, with all the distress that she's experiencing with the pandemic, issues related to transportation, to cost, and all those issues limit access. And so for Maria, it takes her 3 to 4 months to get in to see a psychiatrist and a psychologist. And all the while she's struggling and her depression and anxiety is worsening. As she progresses through her ambulatory mental health care, we see Maria's depression and anxiety worsening. It's clear that she needs a higher level of care, but she doesn't require emergency room level of care or hospitalization. But unfortunately, our system is fraught with a clunky approach where we either have ambulatory care or hospital-based care. And those intermediate services of care, such as partial hospitalization and intensive outpatient programming, day programs that can allow Maria to go and seek mental health care in a more intensive way, but then go home and spend time with her family and not need to be in the hospital, they are lacking, both in our region and in our state. And so Maria, unfortunately, stays in outpatient care, receiving less intensive care than she otherwise should, and her presentation progresses such that she starts developing suicidal ideation. We do know that suicide is the second leading cause of death in youth between the ages of 10 to 24, and we take suicide very seriously, and so does Maria's family. They seek out emergency care, and like many youth with behavioral or mental health crises, there's been a twofold increase in seeking of emergency care for youth since 2006. And many of these youth, up to 40%, may require psychiatric hospitalization, which is a large proportion of those youth seeking emergency care. We've seen a spillover effect where there have been bottlenecks in our emergency room because youth are too acute to go back to the community, but access to psychiatric beds and other intermediate services has been lacking. So we've seen youth staying in the ER for extended periods of time or being transitioned to medical settings to await psychiatric hospitalization. We've seen a 20% increase in psychiatric consultation to our medical units during the pandemic for youth like Maria, who may require both medical and physical health needs, as well as mental health needs. And that's a 5-fold increase from our traditional rate of growth in psychiatric consultation. And so these headlines are very common and increasingly common during the pandemic, where families are struggling to access psychiatric hospital beds. We have 331 inpatient child psychiatric beds in the state of Michigan, which is a 60% reduction since 1993. And that's at the same time we're seeing a 2-fold increase in youth seeking emergency psychiatric care. Waits for psychiatric hospital beds can be up to 4 months, and for youth like Maria, we can't afford 4 months of wait. And oftentimes there may be situations where there are no available inpatient child psychiatric beds in the entire state of Michigan. On our inpatient psychiatry unit at the University of Michigan, the Nyman unit, we've seen an almost 11% increase in length of stay since the pandemic, as well as 93% occupancy, which essentially means that the unit is constantly full year-round. So as Maria's family waits in the emergency room, they may spend days waiting in situations that are fairly confined and have increased distress as they wait, not knowing when they'll be able to get help for their child. And so despite how difficult the situation has been during the pandemic, there's been a silver lining. We have learned that telehealth and delivery of mental health through technology can help expedite access to care. We have learned the value of intermediate services and have a concerted effort currently to look at developing a partial hospitalization program to provide that intermediate level of care that can mitigate the need for emergency room and hospital-based care. We are increasingly exploring opportunities for integrated and collaborative care models, including increasing consultation models to medical settings to support our primary care providers and pediatric subspecialists in delivering mental health care jointly with mental health providers. We are working to enhance innovation in emergency care and hospital care to provide more just-in-time care that's adaptable and customizable to the needs of patients and families. And we're doing all of this with an eye to standardizing care and providing more robust universal mitigation strategies to prevent youth like Maria, who are distressed and were otherwise doing well prior to the pandemic, from getting to the point of requiring psychiatric hospitalization. And with that, I will hand it to Dr. Angela Fish. Thank you.
So at the start of the pandemic, it was frequently said that we're all in the same boat, but really that's far from accurate. And over time, we've really changed that to the idea that we're all in the same storm, but in very different boats. Some of us may even be doggy paddling without the safety of a boat at times. In short, the pandemic has hit some of us in much more significant ways than others. I don't have nearly enough time to go over each of these, but I do want to spend a little bit of time discussing the impact on children and families with neurodevelopmental disorders, especially autism spectrum disorder, and the impact of structural racism on health and mental health. These are particularly salient for me as a psychologist in our ASD team and as a member of our diversity, equity, and inclusion clinical and education subcommittees. So to start with a focus, especially on autism. At its core, individuals with autism have differences in social communication and a pattern of restricted and repetitive interests and behaviors. During the pandemic, kids have had much less access to their social networks and to treatment, and nothing about the pandemic has been structured or routine. And there's been a general heightened sense of anxiety amongst all of us. And all of that has led to an exacerbation of restricted and repetitive behaviors, sleep problems, behavioral dysregulation, and aggression in some people with autism. We also know that kids with and adults with neurodevelopmental disorders may be at a higher risk of contracting COVID in adults because they may live in congregate living situations. For everyone, there's a higher need to get out into the community to obtain services. And individuals with autism may have a harder time wearing masks and social distancing. We also know that there's a higher rate of physical comorbidities with autism, and that may put individuals at risk for worse outcomes from the disease. Now, it was challenging before the pandemic to get access to care, appropriate services. And that has been compounded during the pandemic. If kids are missing their well child exams or having these done virtually, pediatricians might miss some of those early warning signs and not refer as quickly to a diagnostic evaluation. Then kids have to wait to get into that diagnostic evaluation and then wait again to get into treatment. Yet we know that for kids with autism, they do best in intensive early intervention provided in structured, caring, supportive environments that gently challenge their social development. And this has just been much less accessible during the pandemic. We also know that for parents of children with neurodevelopmental disorders, that they are experiencing higher levels of parental burnout and less perceived social support than parents of neurotypical children. Despite these challenges, there have also been some silver linings during the pandemic. Parents who were involved in treatment pre-pandemic, so they were learning the strategies to help their children gain social communication skills prior to the pandemic, that those kids maintained their skills during the lockdown period when they were not getting services. So we know parent training works, and we have emerging evidence that it's working in a telehealth format and in group settings. And we want to expand those offerings here at U of M. We also know that some children are doing better in virtual school without the social and sensory demands of the school environment. And hopefully schools can continue to offer flexible, innovative models for children with autism. The pandemic has also forced a community of practice to emerge, and we're hooked up with centers across the country and world to talk about how to reduce these barriers and with a real focus on telehealth services. We've had a lot of success in especially our early childhood diagnostic clinic. The virtual assessments take out those barriers of distance. They take out the barrier of children being anxious about going to a doctor's office where they usually go and get shots, and with a bunch of unfamiliar adults who, with strange sensory input. We really get a better view of their environment and their relationship with their parents doing these by telehealth. And we hope to continue offering these evaluations and eliminate these distance and environmental barriers. There's good emerging evidence from Italy for a very nice stepped care model that involves telehealth that has a lot of promise for the future. And it's been easier to coordinate with multidisciplinary teams using telehealth. But telehealth is not reimbursed by insurance companies in the same way as in-person care. So even though we have these priorities, it's not easy to do. We also want to continue to expand services for children in psychiatric and behavioral crises, because we know that our psychiatric emergency room visits have increased 50 to 70% for individuals with neurodevelopmental disorders in the past 10 years. We also want to continue to develop services for transition-aged youth. So when they're transitioning between childhood and adulthood, because there really hasn't been enough historical focus on that age group. Yet we know that individuals with autism are often unemployed or underemployed. And then we know that racism is also a factor for children with autism, but for everyone that we see in the Department of Psychiatry. I hope that you all are aware of how COVID is hitting the Black, Indigenous, and people of color much harder than white individuals. In Michigan, for example, Black individuals account for about 11% of COVID positive cases in the state. However, 21% of deaths are due to COVID have been among Black Michiganders. Public health officials have attempted lots of different explanations for this difference, but ultimately it boils down to race-based discrimination or systemic racism, likely accounting for the biggest differences between infection rate and death rate. And that's due to increased chronic toxic stress and social and economic factors that individuals from racial minority groups are much more likely to face. So it's imperative in the Department of Psychiatry that we reduce barriers to access for BIPOC individuals, and that we create a culturally informed environment for all who seek our services. We are in the process of developing a diversity, equity, inclusion strategic plan. And one area that I'm involved in is the implementation of the cultural formulation interview with every patient who comes comes for services in the department. And this is a space where we could use help with supporting training and protected time for this training, because we know that high quality mental health treatment can really help individuals heal. So thank you. And next up is Dr. Charles Graham.
Thank you, Dr. Fish. I welcome this opportunity to discuss for a few minutes adolescent substance use in the context of COVID-19, and to emphasize the need for continuing services and support for youth and their families in this area. This discussion is important in that adolescent substance use is both prevalent and undertreated, with only about 8% of adolescents with substance use disorders receiving specialized treatment, and youth of color and poor youth being disproportionately affected. Prior to the COVID-19 pandemic, we understood adolescent substance use to be primarily social in nature, including its initiation and ongoing patterns. We also understood that illicit drug use among this population seemed to be leveling off, most recently after several years of stark increase. Use primarily revolved around the use of marijuana and cannabis products, and we noted a dramatic decrease in 2018 in cigarette use, and while high, there was another leveling off of daily nicotine vaping. And then COVID-19 happened. Right? And according to a 2020 study of adolescent youth use, before and during COVID-19, several trend changes were noted. First, in frequency, studies found that while the number of adolescent users decreased, those who chose to use increased their frequency, particularly with alcohol and cannabis. The study also focused on the notion of context, where use occurred across multiple contexts, including face-to-face, through technology and solitary use in homes, but there was a significant increase in the percentage and frequency during solitary use, characterized by increased use not only in homes, but with family members. The study also supported the notion that identity matters, and that for those youth who considered their popularity and had perceived reputation concerns, they were more likely to engage in risk-taking behavior, face-to-face use, and engage in use in a much more frequent manner. Also, the study pointed out the relationship between mental health and coping. Solitary use was linked to depressive symptoms and COVID-19 related fears. Use stopped being just social and became a means for many youth to deal with significant psychological distress and a means of feeling better. In sum, COVID-19 has affected youth's initiation and practice of substance use, with use not being only used in social contexts for social reasons, but also as a means to deal with isolation and an increased means to cope with associated mental health challenges. COVID-19's impact has also affected risk and protective factors, where the homes and families that were once, for many, considered protective against use may now become a risk factor related to adolescent early use. And finally, what COVID-19 has done is it's placed a light on the important role of treatment services. Unfortunately, COVID-19 has caused many treatment services to either shut down, downsize, or compromise their services, increasing the risk. that adolescent substance use will go up and be still undertreated. So what do we do? And how do we assist adolescents with these substance use issues? There are many options and many approaches, but many youth are suffering from a lack of social connections, and perhaps embracing alternative means of social connection is needed. The use of virtual peer supports and treatment groups provides the social support and the place for young people to learn and practice and develop effective strategies to cope and to manage whatever substance use related issues may be occurring. Also, it's important that there be specialized treatment and programming services made available to address the unique issues that adolescents deal with in regards to identity, as well as for those young people whose use is not only the, the, the issue that they're dealing with, but who also are battling other psychological disorders such as anxiety, depression, and the like. Finally, the most important piece, I think, is to ensure that families get the interventions and support needed to be effective supporters of their young people. And this can come through education and giving guidance and understanding in regards to what substance use is about, and to assist them in providing means to evaluate emotional and affective um, uh, adjustment, as well as checking in to ensure that youth are doing their level best. Making strides in these areas and others, we can better ensure ongoing recovery, and that the crisis of COVID-19 pandemic will not have lasting and onerous effects on adolescent substance use. Thank you. Now, please welcome my colleague, Dr. Koschmann.
Thank you for that introduction, and hello, my name is Elizabeth Koschmann. I'm a faculty member in the Department of Psychiatry and director of the TRAILS program. It's my pleasure to join you today to speak briefly about the TRAILS program and to offer a few recommendations of strategies that can help improve well-being during the COVID pandemic. TRAILS is a unique program housed at the University of Michigan Department of Psychiatry and the Eisenberg Family Depression Center. The mission of TRAILS is to improve youth access to effective mental health services by training school educators and professionals to use evidence-based approaches to supporting student wellness. TRAILS provides training, resources, and implementation support spanning 3 tiers of student service delivery. At Tier 1, we focus on the well-being of all students in a school environment and equipping classroom teachers with tools and a curriculum to help them promote social and emotional competency in their classroom environments. At Tier 2, we focus on supporting school mental health professionals in their delivery of evidence-based targeted interventions for students impacted by symptoms of depression, anxiety, and other common mental health concerns. At Tier 3, we focus on supporting schools in their identification and management of students at risk of serious self-injury or suicide. Even before COVID-19, student mental health concerns were at unprecedented levels. Data pointed to exceedingly high rates of depression, anxiety, and trauma exposure in young people across the country. Of course, today, the stressors facing school-age youth are unprecedented, and we have seen exponential increases in exposure to traumatic events, as well as in depression, anxiety, and concern for suicide risk. Of course, this all coincides with reduced opportunities to access important mental health services for young people, as many of these services were previously delivered exclusively in the school environment. And due to remote learning, many students cannot access the supports that they need today. We also can't talk about COVID-19 without acknowledging the disproportionate impact on students of color. We know that this disease has impacted marginalized communities disproportionately than many other communities. We also see that COVID-19 is occurring at the same time that the nation has been gripped by the Black Lives Matter movement, thrusting disproportionate treatment of people of color and violence against Black Americans into a spotlight that is relentless and often weighs heavily on the minds of young people, particularly young people of color. I met with a high school junior from Detroit yesterday who said aptly, "Today it's hard to be a student and it's hard to be Black." And I think that sums up the ways in which these dual pandemics really are impacting many young people today. So how is Trails helping? Certainly we can't solve all of these problems, but we have tried to respond in the past year through development of a number of resources and provision of extensive training and support for our school partners. I just want to touch on two recent resources as part of my comments today. One of the products that we've developed in the past year has been a 7-session Coping with COVID curriculum. And this is a resource that guides a school mental health professional or mental health care provider through delivery of a brief multi-session program that teaches students a set of skills for managing their mental health and wellness. This curriculum aligns with another resource, which is a self-care guide to coping with COVID-19, utilizing evidence-based effective coping strategies. I'm going to just highlight a few of the strategies that are discussed in these two resources and hopes that these resources may be helpful for you or helpful for a young person who you care about. One of the first strategies that we recommend is just to encourage students to reflect on the ways in which they may be coping with stress and pressure today. It's normal to reach for a coping skill that's effective quickly. And unfortunately, some of the strategies that we can use to reduce those really uncomfortable feelings that help most quickly also carry long-term side effects. So we ask students to engage in some reflection. Are there any negative side effects or long-term consequences of the ways in which they may be coping? Or if their coping skills became a habit, what would be the implications of that habit long-term? Second, we ask students to not forget the importance of physical activity. There's excellent data that shows the impact of physical activity on promoting mental health and wellness. And so Trails makes available to students a resource that helps them overcome some of the barriers to physical activity, including low motivation or just not being able to find the time or opportunity to engage in physical activity. Third, we know that relaxation is not a one-size-fits-all approach. And so Trails provides a variety of resources and tips for learning how to engage in deep breathing, guided meditation, yoga, muscle relaxation, and many more approaches that are effective for relieving some of the physical tension and stress symptoms that accompany common mental health concerns. Finally, we know it can be very helpful just to track well-being over time and to recognize ways in which different coping skills are more helpful than others. So Trails has made available a PDF fillable online daily wellness journal that young people can use to just track how they're doing across time, as well as the coping strategies that they're using and how helpful those strategies have been. All of our materials are made free and publicly available at trails2wellness.org. And the past 12 months have really shown just how needed and impactful resources like ours can be. Since April of 2020, we've had over 1 million page views at the Trails website. And more recently, our materials are downloaded at a rate of 1,000 times a day. Our website analytics tell us that users of the Trails resources represent not only all 83 of Michigan's counties, but also all 50 US states and 125 countries globally. So we can see that there's a huge demand for materials like these and that our materials really are having an impact. I wish I had time to say more about the incredible role of philanthropy and grant making in our ability to use Trails as a platform for reaching and serving students across the country and the globe. Our supporters have been fundamental not only to our foundation as a program, but also to the growth and impact that Trails has been able to achieve. We're grateful to our supporters and look forward to future collaborations with all of them. Thank you so much for your time today. Now I look forward to shifting to the question and answer portion of our event. Thank you so much.
Thank you to all of our panelists for joining us today and for sharing your thoughtful review on the impact of the pandemic on the mental health of children and adolescents. I'd like to invite all of our speakers on screen, and for our audience members, please note that our presenters cannot give personal patient recommendations at this time, but can give general advice. We are now going to dive into the question and answer portion of the webinar, taking a few pre-submitted questions, followed by our live Q&A using the Q&A Zoom feature at the bottom of your screen. Please know that your names will not be shared on the screen or seen by the panelists as you put in those questions. I think we have all of our panelists with us at this point. So let me just go to the first question. As the world becomes increasingly technological, social media has more and more of an impact on socialization in teens. How is this impacting teens' social skills when they don't socialize the way they used to? What are your thoughts about social isolation as it relates to social interaction online? Who wants to take a swing at that?
Hi, Gregory, it's Nasu Malis. I can start, and certainly we have a wealth of experience here. We can all kind of chime in as needed, but this is a really important question. Social media is increasingly becoming a very important way for youth to communicate, to express themselves, to connect socially. And there's been increasingly a lack of opportunity to socialize in other ways. And one of the things that we touched on in our presentations is a lack of social connectedness. A lot of our youth are coming to us and telling us they feel isolated, they feel lonely, they feel a loss of identity because they can't congregate in their sports teams, in the classroom, and in other settings. So increasingly, this is happening through social media. And social media can be a powerful tool to advocate, to socialize, to connect with family and friends. But we're also seeing a rise in cyberbullying and some emphasis on appearance and other maybe maladaptive interactions that youth may experience. One of the things we didn't touch on as much is a significant rise, almost a tenfold rise in eating disorders in youth. And we've seen that as a phenomenon during the pandemic. And one of the positive associations is that with increasing social media use, there's been an emphasis on bodily appearance that we haven't seen as much before. So I think there's a lot of downstream effects, and it's really important that we study this very closely and think about how we can make sure maladaptive use of social media doesn't cause our youth significant distress, and we can kind of ameliorate that as a factor.
Great, thank you, Nasu. Let me ask a question perhaps for Angela and Elizabeth. What services are being provided to help children and adolescents who have severe anxiety about returning to in-person school after being away from it for over a year? And what about the special population of students with learning disabilities in that vein?
Okay, I guess Angela and I are trying to be polite and give each other space to offer. What I can share is that there is a never before seen awareness among school administrators and school mental health professionals on the importance of promoting student wellness holistically, thinking about all students as well as students that have special learning needs or previously had a diagnosed mental health concern. So I think that one thing that we are going to see as we head into school in the fall will be really clear, comprehensive plans that schools will put into place that will improve access to mental health services for all students, improve professional development for school mental health professionals, so that they're more equipped and have the tools and resources to provide mental health support through the school setting. And then certainly increase partnerships and care coordination with community health providers. I noted in the questions or the comments, somebody noted the importance of just pointing out that community health care delivered by social workers and counselors, and not only hospital-based or inpatient care, is a really critically important part of the network of care providers that are supporting students. And certainly those allied professionals will play a huge role in supporting student mental health. Angela, why don't I turn to you?
Yeah, sure. Thanks. I agree with everything that Elizabeth mentioned. We also put some resources in the chat for families. So there's all of the resources on the Trails website. The Zero to Thrive website is amazing for younger kids, kind of under the age of 6. And our department website has a lot of resources for different relaxation exercises that you can do with your kids to start helping with this. And I think generally parents working and having a good communication back and forth from the schools can do a lot of good for kids. So I would recommend getting in, if you're worried about this, getting in touch with your kids' teachers now to start talking about how can you make that transition go easily in the fall.
Great, thank you both very much. Charles, I have one that I might ask you to respond to initially. Elizabeth at the end talked about coping skills, and we know that not all of them are terribly adaptive. What might be some signs to watch for that your child is turning to substances as a coping skill?
Yes, that's a popular question that's asked by many parents, and perhaps even more so now that they're seeing them more in the homes. There are a number of signs of emerging substance use. These signs don't necessarily indicate substance use, but certainly could give some hint that there may be an emerging problem in that area. Dramatic changes in mood, extreme mood changes are sometimes a strong indicator that they are responding to the substances that they're taking. Significant isolation that's dramatically different from their normative style, choosing to be in the room instead of coming out, or choosing to engage in certain emotional isolative behaviors that are so uncharacteristic that it makes you wonder, where's my child? What's going on with my child? You can maybe see some changes also in the physical appearance and the upkeep and how they care for themselves. Sometimes that goes to the side as they are focusing more on use. And finally, I think it's real important to appreciate how the function, overall social functioning, the person may show that it's their decreased functioning academically, socially, and in other areas. Again, all of these don't necessarily indicate use. They could be the result of just hormonal changes and other issues. They can certainly be related to other psychological issues as well. But there may be a way to provide an opportunity for further communication as well as assessment to determine whether or not an emerging problem is occurring.
Great, thank you very much. We have a number of questions trying to get a sense about how to help children, some who may have anxiety or be introverted at baseline, return to the school environment. How do we know that it's safe? How do we make them feel that it's safe? How do we help them re-socialize in person when all of their socialization has been online for so long?
I think it's great that if parents are recognizing some behavioral changes in their kids and they're seeing those and recognizing those as anxiety as a first step. And then, in terms of addressing safety, I would say talk to your pediatrician because they know your child's specific medical needs and can certainly help make those decisions. And then beyond that, I think utilizing those coping skills with your kids and trying some of those relaxation strategies and starting with things that are maybe a little less scary that you're going out and doing something, and then building up to things that are maybe a little bit more anxiety provoking.
Go
ahead.
Can I add something? So I love that response, Angela. And I think, knowing people who know your child well and engaging them is really helpful. And parents know their kids. They may know something is off, but they don't know what exactly is off. And so being aware of that instinct that you have as a parent, that something is amiss, awry, that the personality of your child's different, and trying to engage people, whether it's a trusted school professional, the primary care provider, people that are really aware of the situation. And then I think the other thing that's really important is dialogue, creating open conversation, recognizing our own insecurities and difficulties as parents, as adults, and kind of modeling how we are also struggling with the uncertainty of the situation, as well as kind of engaging the child to really proactively have some time and some space to talk through some of their fears and worries. And I think by doing that, you can get a better sense of what's needed for each unique child.
Thank you.
Can I add one more comment there just really quickly? Is just the value of how you're taking care of yourself as a parent, that right now we are all under tremendous stress, some more than others, but kids do far more of watching than they do of listening, especially if you're a parent of a teenager or a young adult. So just pay attention to how you are modeling coping with your own stress and anxiety, and that will get you a long way too.
Thank you. Those are great answers. I wonder, maybe Elizabeth, I can ask you to elaborate more on a sort of a follow-up question, which is, are there approaches or thoughts about how to help preteens and teens? I think about teens who are social media experts right now, having this year virtual. I think about the preteens. I've heard stories about kids who are supposed to start middle school, always a difficult time right as the pandemic hit. And so they've been virtual this whole time. Now they're going back into a kind of a testy social environment. Are there particular kind of tips that you can give parents who are dealing with those issues, how to help their kids socialize and return to what's referred to in the question as 3D interactions?
Yeah, I mean, I think it's going to be very dependent on the child that you have and the amount of anxiety or concern that they're experiencing. But I actually think that kids have tremendous resilience and strength and flexibility. And, I have one of those kids who is headed into middle school, Angela too. And, the first day back was very stressful. So we tried to equip, our son with some coping strategies, go through some of those fears that we can get him to put into words and sort of give him some skills to sort of evaluate the authenticity of those worries. And then we kind of send him out there and we help him trust that the safety precautions that are in place to prevent disease transmission, virus transmission are working. And by, day 2 or 3, we have a kid who's had an opportunity to test those worries and see that many of them didn't actually materialize and that school actually went well. Of course, that's different. It's going to work differently with each kid, but having a little bit of capacity to trust the process will help, I think, a lot. Angela, I know you had some thoughts as well, maybe.
No, I just echoing, I think exactly what you said. Yep.
Great, thank you. Charles, a question from one of our attendees. My child uses marijuana to treat his boredom, isolation, anxiety. Is it better to treat the substance use or the anxiety first, or in what order?
Excellent question. Broadly speaking, we kind of look at substance use and look at the order of co-occurring conditions in this way. Sometimes use induces particular reactions. For example, a person starts using as a result of their use, they may induce some level of depression or anxiety because of whatever may be happening, the withdrawal issues, or just adjusting to the substance. On the other hand, some youth use as a way of coping, right, with the anxiety and the depression. And so I do think it's really important to find the role in which the use is playing, because then that determines that if you deal with the substance use as a primary issue, typically anything else that is resulting from it will be somewhat diminished if you take care of the substance use problem. On the other hand, if the major issue is a more self-medication kind of piece, a way of trying to deal with depression, it might be real important to focus on providing assistance in managing and coping with anxiety. And then there may not be a need for further use because the initial problem is taken care of. Certainly these issues are a bit more complicated when there's co-occurring disorders. And in that case, it requires a sort of comprehensive approach. You have to address both at the same time. But assessment is really important, and really knowing your child and understanding the role the substance is playing plays an important role.
Charles, can I make a quick comment? Because, you know, I think what we see a lot is when there's co-occurring substance use and mental illness, a lot of times our youth come with a misdiagnosis because the providers are maybe seeing the outward effects of the substance use and maybe labeling that as not related to the substance use. So can you talk about kind of when you're thinking about the diagnostic assessment, you know, really being mindful of making those diagnoses when somebody's actively using and not kind of over pathologizing things that really are related more to the substance use?
Great point. And that's why it's so important that extensive and comprehensive assessments be done, that oftentimes what individuals are really experiencing are really physiological reactions to the substances, right? And sometimes the interpretation of what's going on in terms of mood, in terms of attitude, in terms of drive and motivation, if not appropriately assessed, could be ascribed inappropriately, right? And could be, it could lead to not only a misdiagnosis, but a wrong approach to treatment, and that sometimes over treating a condition creates even more problems than are needed. So yeah, there's a real significant importance of assessment and a thorough evaluation of what substances are being used, because substances, each substance has their own impact and physiological response.
Great, thank you. There are a number of questions, as all of us might anticipate, about challenges in access, how to get services for your child, particularly specialty services. And there are a lot of things we could talk about in that way. I wonder if anybody wants to at least begin with a comment about our approach to trying to expand access to services in a variety of different ways. I guess maybe that's me. I'll start. So we are aware that for many reasons, there are not enough mental health professionals, social workers, psychologists, psychiatrists, to meet the demand. And so part of our effort is to try and assist, work with, partner with our primary care colleagues in family medicine, general medicine, pediatrics, because that's where the vast number of initial presentations occur, and trying to help them meet the demand of patients and their families as best they can. And you've heard some of that as we try and build our continuum of care, have consultants in a variety of settings. There's a whole other webinar maybe we can do at some point about the challenges with mental health reimbursement and overcoming stigma that make it hard for us to scale up the way we need to. We are certainly working on that, but a lot of the effort is to try and provide the services where they're initially presenting to the extent that we can, and then be available for more in-depth, higher order services where the need is greater in that way. The TRAILS program is an excellent example of getting quality evidence-based treatment services into the schools where the school personnel are providing those services to try and meet early on the need that students may have. And those that have more serious conditions that require more intensive care can then hopefully access a specialty resource that is less occupied with trying to meet a much broader range of very mild to very severe kinds of symptoms and mental illness. Great. Another question about the return to school. So I think it's been noted in the question and answer that a lot of the focus is on the physical safety and not so much on the emotional or mental health safety in the return to school. I wonder, maybe Elizabeth, if you could talk a little bit about that and what you're seeing in your interactions with school systems.
Yeah, I think Michigan is just an incredible example of how much student well-being has been really thoughtfully considered. Governor Gretchen Whitmer put together in last spring a student return to school roadmap, and more recently a student recovery advisory council. And that council had a number of subcommittees, and student wellness and the impact of racial trauma was a subcommittee that I had the privilege of chairing. And that committee has made a number of recommendations that the governor will be pushing out to schools. And we have already seen just huge demand for guidelines, recommendations, professional development, and COVID relief funding will have a very big impact on the capacity of schools to deliver effective services. So I think schools are going to be doing a lot to share that burden with families.
Great, thank you very much. So to all of our attendees, you have been a very, very engaged and interactive audience. I know that there were a lot of questions that we did not get a chance to get to in the Q&A portion here. We will try and get some information out as best we can in response to this. I'm also aware that there was some concern that some of the slide presentations were a bit blurry as they were rendered on the screen. We apologize for that. We will certainly get access to the slides out to all of you as we get out the link to the recorded webinar that you can share with family, friends, other people that you know who may have interest here. At this point, we're going to draw to a close. I just would like to make a few comments. First of all, I want to thank all of our panelists for offering your valuable time and your expertise this afternoon. I have the privilege of working with all of these people, and it's just very gratifying to know that these are the folks that work in the community. And I hope that all the attendees found this session informative and that you learned some things that could be applicable to your own lives, the lives of your children and your families. I want to also extend my sincere gratitude to the wonderful community of donors who have joined us today, and special thanks to those of you who support or plan to support the mental health programs that we are running and putting together at Michigan Medicine. Your generosity enables us to do great work, some of which you learned about today, to directly impact the lives of those who entrust us with their care. Ultimately, we are hopeful that some of you will choose to build an ongoing relationship with us and perhaps even engage philanthropically if you find meaning and promise in what you learned today. There is a lot we can all do to advance this work, especially if we work together. If you enjoyed today's presentation and found it valuable, you might consider helping us ensure we can continue to provide educational programming like this in the future for patients and their families, members of the community, students, educators, and healthcare providers by making a gift to the Psychiatry Education and Outreach Fund. In addition, we're going to be posting on Michigan Medicine's Facebook and YouTube pages. A recording of this webinar will also be included in a follow-up email to all of you who registered, including the slides, as I mentioned before. Please feel free to share this recording with friends or family who might be interested. Also in that email will be a link to the Department of Psychiatry website with information on how you can get involved and support our efforts across all aspects of mental health care, research, and education. We look forward to staying in touch and keeping you apprised of our work. Finally, I hope you will join us for the next Well Aware webinar, Staying COVID Smart during summer 2021, That will take place on June 10th at 12 p.m. That's Staying COVID Smart during the summer of 2021 on June 10th at 12 p.m. So to all of our attendees and our panelists, thank you for attending. Please stay healthy and safe this spring. Thank you and go blue.